I want you to listen closely because what I'm about to share with you could genuinely change your life or the life of someone you love. Pancreatic cancer is one of those diseases that doctors talk about in hushed, serious tones, and there's a real reason for that. It's often called the silent killer, not because it isn't sending out signals, but because most people simply don't know what those signals look like. And by the time they find out, it can already be in a very advanced stage. That's not meant to scare you. That's meant to wake you up because knowledge, real, honest, practical knowledge, is the single most powerful tool you have when it comes to protecting your health. I've spent years studying how the body communicates distress, how it tries to tell us something is wrong before things spiral out of control. And one of the most important lessons I've learned, and one I want to pass on to you today, is that your body is always talking. The question is whether you're listening. Today, we're going to talk about 5 symptoms of pancreatic cancer that most people either ignore or mistake for something completely harmless. Some of these are going to surprise you, some of them might even shock you, but all of them are worth knowing. Before we get into it, I want to ask you something genuinely important. Have you or someone close to you ever experienced any unexplained digestive issues, sudden weight loss, or just a nagging feeling that something wasn't right and brushed it off as stress or aging? I'd really love to hear your answer in the comments below. Tell me your experience. You might just help someone else reading your words today feel less alone and take that step toward getting checked out. Your story matters more than you know. Now, let's get into it. The pancreas is a long, flat gland that sits tucked behind your stomach in the upper left abdomen. Most people don't think about their pancreas very often. It's not like the heart or the lungs, which we're all very aware of, but this organ is doing incredibly important work every single day. It produces enzymes that help your body digest food, breaking down proteins, fats, and carbohydrates. And it also produces the hormones insulin and glucagon, which regulate your blood sugar levels. When the pancreas is healthy, everything hums along quietly. But when something goes wrong, when abnormal cells start growing and dividing in a way they shouldn't, things can begin to shift in ways that show up throughout the body. The challenge with pancreatic cancer is its location. Because the pancreas is so deep inside the body, tumors that grow there don't often cause obvious pain or discomfort right away. There's no lump you can feel from the outside, no visible sign you can see in the mirror. The symptoms tend to be subtle at first, which is exactly why I want you to know them. Let's talk about the first symptom, and I want you to really pay attention here because this one is very commonly dismissed as something completely unrelated. The first symptom is jaundice. And yes, this one can be shocking when it appears because it changes the color of your skin and eyes in a way that's unmistakable. Jaundice is when your skin and the whites of your eyes take on a yellowish tint. It can also cause your urine to become very dark, almost like the color of dark tea or cola, and your stools to become pale, almost clay colored or chalky white. Now, why does this happen? When a tumor grows in the head of the pancreas, which is the most common location for pancreatic tumors, it can press on or block the bile duct. The bile duct is the small tube that carries bile from your liver and gallbladder into the small intestine. Bile is a yellowish green fluid that helps digest fats, and it also contains a pigment called bilirubin, which is a byproduct of the natural breakdown of red blood cells. When bile can't flow properly because of a blockage, bilirubin builds up in your blood and starts to leak into tissues throughout your body, including your skin and the whites of your eyes. That's what causes that yellow discoloration. What makes this significant is that jaundice caused by a pancreatic tumor is what doctors sometimes call painless jaundice. That means the yellow discoloration appears without the severe abdominal pain that usually accompanies gallstones, which can also cause jaundice. So many people see themselves turning yellow in the mirror, and because they aren't in excruciating pain, they assume it must not be serious. Please don't make that mistake. Painless jaundice should always prompt a visit to your doctor. Always. It may turn out to be something less serious, a liver issue, a medication side effect, gallstones, but it should never, ever be ignored. Something else that can accompany jaundice from pancreatic obstruction is intense itching of the skin. This happens because bilirubin can accumulate under the skin and irritate nerve endings. People often describe it as a deep internal itch that doesn't go away no matter how much they scratch. That kind of persistent, unexplained itching, especially when paired with any yellowing, is another signal worth investigating immediately. Now, the second symptom, this one is quieter than jaundice, and that's precisely what makes it so dangerous. I'm talking about unintended weight loss and a loss of appetite. I know what you might be thinking. Lots of things can cause weight loss: stress, depression, thyroid problems, changes in diet. And you're right. But the kind of weight loss associated with pancreatic cancer tends to be rapid, unexplained, and progressive. We're not talking about losing a few pounds because you've been eating less or moving more. We're talking about losing a significant amount of weight, sometimes 10, 15, 20 pounds or more, without trying, without wanting to, and often without even fully noticing at first because it can happen gradually. Here's what's happening underneath the surface. Pancreatic cancer interferes with digestion in a very real way. The pancreas normally produces digestive enzymes that are essential for breaking down and absorbing the nutrients in your food. When a tumor disrupts the function of the pancreas, those enzymes may not be produced in sufficient quantities, which means your body can't absorb fat, protein, and other nutrients properly. The food passes through your system without being fully used. Your body starts essentially running on reserves. On top of that, cancer itself is metabolically demanding. Tumor cells consume enormous amounts of energy. They need glucose and nutrients to survive and multiply. Your body is also mounting an immune response, which takes energy. All of this adds up to a kind of systemic depletion that you feel as weakness, fatigue, and loss of weight that you simply cannot explain. The loss of appetite that often accompanies this can compound things. You may find that food that used to excite you now holds no appeal, or that after just a few bites, you feel uncomfortably full. This early satiety can be caused by the tumor pressing on the stomach or affecting the normal movement of food through the digestive system. Here's the message I want you to hold on to. Anytime you or someone you love is losing weight without trying, especially if it's more than 5% of your body weight over 6 to 12 months, that is a reason to see a doctor and ask questions. Don't normalize it. Don't assume it's stress. Don't wait. Let's move on to the third symptom. And I think this one is going to genuinely surprise many of you because it's one that almost never gets connected to the pancreas in everyday conversation. I'm talking about new-onset diabetes, specifically being diagnosed with type 2 diabetes suddenly, especially in someone over the age of 50 with no previous history or typical risk factors. Now, we all know that diabetes is incredibly common. Millions of people are diagnosed every year. So, how does a diabetes diagnosis become a warning sign for something like pancreatic cancer? This is where it gets fascinating and important. The pancreas, as I mentioned earlier, is responsible for producing insulin, the hormone that regulates your blood sugar. When a tumor damages or destroys enough of the insulin producing cells in the pancreas, the body loses its ability to regulate blood sugar effectively. The result is a rise in blood glucose levels, which presents exactly like diabetes. Studies have shown that in a significant number of pancreatic cancer cases, a new diagnosis of diabetes actually precedes the cancer diagnosis by 1 to 3 years, meaning the diabetes wasn't the disease, it was the warning. It was the body's way of signaling that something was wrong with the pancreas long before the cancer was found. What should raise your attention is this. If you or someone you know is suddenly diagnosed with diabetes without the usual risk factors, without significant overweight, without a family history, without gradually worsening blood sugar over years, and especially if this happens alongside other symptoms like unexplained weight loss or digestive changes, it's worth asking your doctor specifically about the health of your pancreas. Not every sudden diabetes diagnosis is cancer. In fact, most are not, but it's a conversation worth having and a proactive test worth requesting. This is also why it's so important to maintain regular checkups with your doctor. A routine blood sugar test that reveals a sudden shift in your glucose metabolism can become a life saving piece of information if it's taken seriously and investigated thoroughly. Now, I want to talk about the fourth symptom, and this one is perhaps the most uncomfortable to discuss because it involves changes that people often feel embarrassed to bring up with their doctor. I'm talking about digestive symptoms, specifically fatty, greasy, or unusually foul smelling stools, along with nausea, bloating, and in some cases, new or worsening pain in the abdomen or back. Let's start with the stool changes, because I know that's not exactly dinner table conversation, but it is important. When the pancreas isn't producing enough digestive enzymes, which happens when a tumor is present, fat in your diet can't be properly absorbed. Instead, it passes through your digestive system largely undigested. The result is stools that are pale, oily, float in the toilet, or are accompanied by a particularly strong and unpleasant odor. This condition is called steatorrhea, and it's a classic sign of pancreatic insufficiency. You may also notice an oily sheen on the water in the toilet bowl, or that stools are difficult to flush away. Now, combine this with nausea, vomiting, or a bloated, uncomfortable feeling after eating, and you start to build a picture of a digestive system that is significantly compromised. These symptoms are often passed off as irritable bowel syndrome, food intolerance, or a stomach bug that just won't quit. And sometimes that's exactly what they are. But if these symptoms are persistent, worsening, or accompanied by any of the other signs I'm describing today, they deserve a much closer look. The back and abdominal pain is worth addressing separately because it's a nuanced signal. Pain from pancreatic cancer is often described as a deep, dull ache in the upper abdomen that radiates through to the back. Some people describe it as feeling like a band tightening around the middle of their body. It can worsen after eating, and some people find that leaning forward or curling into a fetal position provides some slight relief, which is notably different from other types of abdominal pain. This happens because the tumor, as it grows, can press against nearby nerves and organs, causing pain that travels through the body in ways that feel confusing and hard to localize. The important thing here is persistence. A stomach ache that comes and goes, that gets better with antacids or rest, is usually not a serious concern. But pain that is there most of the time, that doesn't respond to typical remedies, that seems to be slowly getting worse over weeks or months, that is your body asking you to pay closer attention. And now we arrive at the fifth symptom. This is the one that I personally find most striking because it is the furthest from where you'd think to look. I'm talking about the sudden appearance of blood clots, a condition called deep vein thrombosis, or DVT, particularly in people who have no obvious reason for clotting. Here's something that many people don't know. Cancer cells, including those in pancreatic cancer, can produce substances that interfere with the body's normal clotting processes. The result is that the blood can become what doctors describe as hypercoagulable, meaning it clots more readily than it should. This can lead to blood clots forming in the deep veins of the legs, causing swelling, warmth, redness, and pain, particularly in one leg. If a clot breaks off and travels to the lungs, it becomes a pulmonary embolism, which is a life threatening emergency. What makes this so significant as a warning sign is when DVT appears in someone who doesn't have obvious risk factors. Someone who hasn't recently had surgery, hasn't been immobile for long periods, isn't on certain medications, and has no personal or family history of clotting disorders. When blood clots appear in that context, especially in the setting of any of the other symptoms we've discussed today, doctors are trained to investigate further. There's actually a historical name for this connection between cancer and blood clots. It's called Trousseau syndrome, named after the French physician Armand Trousseau, who noticed in the 1800s that unexplained migratory blood clots were sometimes an early sign of an internal malignancy. He even noticed it in himself and correctly predicted his own diagnosis of stomach cancer from it. That observation from nearly 2 centuries ago is still medically relevant today. So if you or someone you know develops a blood clot that seems to come out of nowhere, Without the usual explanations, please don't just treat the clot and move on. Ask your doctor to look deeper. That conversation could be one of the most important you ever have. Now, I want to bring all of this together for you and talk about what you should actually do with the information I've shared today, because information without action is just anxiety. And I don't want to leave you feeling scared. I want to leave you feeling informed and empowered. The five symptoms we've covered today are jaundice and skin itching, unexplained weight loss and loss of appetite, new onset diabetes without typical risk factors, digestive changes, including fatty stools and persistent abdominal or back pain, and unexplained blood clots. None of these symptoms on their own is a diagnosis. Any one of them in isolation could have a completely benign explanation. But if you notice two or more of these occurring together, or if any single one of them is persistent, worsening, or simply doesn't feel right, please go and see your doctor. Tell them everything. Be specific about what you're experiencing, when it started, and how it has changed over time. I also want to say this directly. If you have a family history of pancreatic cancer, or if you carry certain genetic mutations, such as BRCA1, BRCA2, or mutations associated with Lynch syndrome, your baseline risk is higher than the general population, and that makes regular monitoring and open communication with your doctor even more important. People with a family history of pancreatic cancer may be eligible for surveillance programs that include imaging studies like MRI or endoscopic ultrasound, which can detect early changes in the pancreas before symptoms even appear. And if you're a smoker, I say this with complete respect and without judgment, please hear this. Smoking is the single most significant modifiable risk factor for pancreatic cancer. It's estimated that smokers have roughly twice the risk of developing this disease compared to non smokers. If quitting smoking has been on your list of things to do, let this be the reason that moves it to the top. There are more resources available to help you quit now than at any other time in history, and your pancreas and your whole body will thank you in ways you may not be able to fully imagine yet. Other known risk factors include obesity, long-standing chronic pancreatitis, exposure to certain industrial chemicals, and a diet very high in processed foods and red meat. On the other side of the equation, some things that appear to be protective include maintaining a healthy weight, regular physical activity, a diet rich in fruits and vegetables, and limiting alcohol consumption. These aren't guarantees. Nothing in medicine is a guarantee, but they are meaningful steps that add up over time. I also want to take a moment to speak directly to those of you who may already be on a journey with pancreatic cancer, either as a patient or as someone supporting a loved one through treatment. I see you, and I want you to know that advances in treatment have been meaningful and real. Surgical options like the Whipple procedure, combined with chemotherapy regimens that have been refined over the past decade, have extended survival and improved quality of life for many people. Clinical trials are actively investigating new therapeutic approaches, immunotherapy, targeted therapy, CAR T cell therapy, and the landscape is changing. Hope is not naive when it is grounded in the real progress that researchers and oncologists are making every single day. Survival from any cancer is most strongly associated with early detection. The earlier a pancreatic tumor is found before it has spread to nearby blood vessels, lymph nodes, or distant organs, the more treatment options are available and the better the outcomes tend to be. That is why every conversation about symptoms, every doctor's visit, every question you ask matters. It is not paranoia to take your health seriously, it is wisdom. One last thing I want to share with you, and it's something that I genuinely believe with everything I have. The most powerful thing you can do for your health is to know your body. Spend time with yourself. Notice when something feels different. Don't dismiss changes that linger. Advocate for yourself when you're in a medical office. Ask questions, request explanations, seek second opinions when something doesn't feel resolved. You are not bothering your doctor by being thorough. You are doing exactly what a good patient and a good self advocate should do. Our bodies are remarkable and they tell us things. Jaundice in the mirror, weight that keeps dropping, blood sugar that suddenly spikes. digestion that no longer works the way it used to, a clot that appears without reason. These are messages, and taking those messages seriously, not with panic, but with calm, determined attention, is one of the greatest gifts you can give yourself and the people who love you. If you found this information valuable today, and I truly hope you did, please share this video with someone in your life who you think needs to hear it. It could be a parent, a sibling, a friend who's been complaining about digestive issues for months and brushing it off. You never know whose life a piece of timely information can change. And if you haven't already, please subscribe so you don't miss future videos, because I'm here to give you honest, evidence based health information that respects your intelligence and genuinely wants to help you live a longer, healthier life. And remember what I said at the beginning, drop a comment below and tell me, have you or someone you know ever experienced any of these symptoms? Were they explained? Did you get the answers you needed? Your story matters here, and this community is a place where open, honest health conversations are not just welcomed, they're celebrated. Take care of yourself. You are worth every effort it takes to stay healthy, and you deserve to feel good in your body for as long as possible. I'll see you in the next one.